How to get an MRI with hair extensions. What if I told you that having hair extensions doesn't always mean that you have to take them out before getting an MRI? In this video, I'll break down exactly when you can leave your hair extensions in, what to ask your radiologist, and how IBE beads are designed for safety. We get this question all the time. Can you get an MRI if you have hair extensions in? Well, the short answer is yes, in many cases. But it depends on where your MRI is and what kind of beads are in your hair. MRI machines use powerful magnetic fields and radio frequency energy. Any metal near the scan area can heat up, distort the image, or cause discomfort. So it's important to know what's in your hair and how it reacts to magnetic fields. IBE beads are non-magnetic and nickel-free. They're made from a proprietary blend of aluminum and copper that's flexible and safe. Because they're non-magnetic, they don't interact with MRI magnets. And because our method uses minimal bead placement near the scalp, there's less metal exposure than traditional microbead or I-tip methods. That combination helps reduce potential risk, but it's still important to talk with your doctor before any scan. If your MRI is far from your scalp, you can usually keep your extensions in. That means scans for your legs, knees, feet, abdomen, pelvis, or lower back are typically safe. The magnetic field used in those scans doesn't reach your head. If the MRI is for your head, neck, or upper spine, your radiologist may ask you to remove the beads near that area. Here's what to do if your client needs an MRI. Step 1, know where the scan is happening. If it's below the neck, you're likely safe. Step 2, disclose your extensions. Tell your medical team that you have extensions with aluminum copper beads that are non-magnetic. Step 3, confirm with your radiologist or MRI technologist. Ask if the scan area is close enough to the scalp to be a concern. Step 4, remove beads only if required. You don't have to uninstall everything, just the section near the scan zone. Step 5, speak up during the scan. If you feel any warmth or discomfort, tell the technologist immediately. Here are some common questions. Will my extensions heat up? Because our beads are non-magnetic and small, the risk of heating is very low, especially for scans far from the scalp. Will they ruin the MRI image? Well, they could if the beads are directly in the scan area, which is why communication with your MRI team is key. If I have to remove the beads, do I need to redo my entire install? Usually not. Your stylist can remove just one row and reinstall it afterwards. When we say localized MRI far from the scalp, we mean scans like the lower back, pelvis, or legs. Those are anatomically distant from the head, and the radio frequency field doesn't reach your extensions. If it's a head, brain, or upper spine MRI, removal might be necessary. Here are some safety reminders. Always, always, always consult your doctor or radiologist before any MRI. If they tell you to remove your extensions, do it. Safety and image quality come first. Be transparent about your extension materials, your bead specifications, and how many you have. If you ever feel heat or tingling near your scalp, stop the scan immediately. So yes, in many cases you can get an MRI with extensions, but only if you know what to check, what your beads are made of, and how to communicate with your medical team. Our IBE beads are engineered for safety, but your doctor has the final say. If you're a stylist and want to learn how to install safe, professional, scalp-friendly extensions, check out IBE certification to learn more. And as always, consult your doctor before any MRI scan.